Hello, my name is Cornell Bondurant, and I'm the Director of Social Emotional Learning for the Rockford Boys and Girls Club. And I'm here to talk to you more about our program as relates to severe emotional disturbances and mental health accessibility. So within the community support system framework, three of our major pillars fall into case management, family and community supports, as well as increasing our crisis response throughout all five of our clubs. Case management is one area that we really want to focus on specifically as we work individually with the kids. It gives us a way of tracking interactions, monitoring growth, as well as tracking referrals made as relates to who the referrals were made to, when, where, and possible outcomes. Another layer is the family and community support. So within this, it's really bolstering our training for staff, creating a professional development calendar, as well as ensuring that staff have all the tools necessary as it relates to understanding trauma, as it relates to working with kids who have gone through severe emotional disturbances and forms of trauma, and how to work with them on an ongoing regular basis. Crisis response is the third pillar that we really want to put a key focus on too, because we have the great opportunity of working with kids right when they come from school. So some kids, depending on the day, may have done poorly on a test, may have been reprimanded at school, maybe they're actively going through bullying. But it gives us the opportunity to meet with kids as soon as they walk into our clubs and address concerns. Um, and support them the best way possible. And we find that increasing our response to crises allows us to build those relationships, not only with the child, but also with their families. Here's a quick breakdown and distribution of our funding received. 30% going towards case management, 25% towards mental health treatment, 25% towards client outreach and identification, 15% for family community support, and 5% to crisis response. Five of the core concepts that we really want to focus on a daily, ongoing basis as we're working with the kids within our clubs are self-management, self-awareness, responsible decision-making, relationship skills, as well as social awareness. We really feel that these five concepts really build the character and social emotional well-being of all of our kids. And we really want to be able to support all these equally, as well as which ones kids need a little bit more of. Every child may be in a different state of this development. So we try to utilize each one differently based on who we're working with, as well as the club that we're working with them at. So a quick overview of the implementation of staff education. Just as I mentioned, we really put a big focus on staff education as it relates to training and development. So building out a ongoing staff development and professional development calendar. So most recently, we held our first professional development day this past February, where we had over 70 members in attendance, in which over half of those attendees received an hour-long trauma training facilitated by myself, going over what trauma is, how to identify it, what trauma triggers are, as well as working with kids who may have experienced different forms of trauma. Next is our social emotional learning mentorship program. So throughout all five clubs, we work directly with the directors and ask them to supply and provide 10 to 15 kids who they really felt could benefit from ongoing continuous conversations and check-ins, where we could either meet with them in a group setting or a one-on-one setting based on the specific needs of each child. Currently, 61 kids are getting either a weekly group or a one-on-one session. And within these sessions, we discuss goal setting, understanding emotions, how to regulate emotions, and whenever we feel elevated, how can we channel those emotions into something else? Partnerships is something that we also pride ourselves on greatly. One of that being the IRIS system and being able to receive referrals from partnering organizations where families are looking for specific outlets for their children. We also pride ourselves on the ability to make referrals out. We understand as an organization that we may not be able to support every single need that a family or child may have. So, in working with our families and working with our kids, we really look forward to also being able to refer to our partnering organizations. So if the family that is lacking in food or housing instability, having the ability to make a referral directly to an organization that supports that is something that we greatly look forward in broadening as well. Next, definitely our Rosecrans partnership, providing ongoing clinical counseling for kids and families who need it. Currently, we have one counselor at our Black Hawk unit who's there a couple hours a week, meeting with kids, meeting with families, and providing those on-site services for the kids who need those ongoing clinical supports that maybe we can't provide as an organization. The plan moving forward is to have at least one of those counselors per club weekly to spend a couple hours a week meeting with kids and families who really need those additional hands-on clinical supports and services. Here's a quick screenshot of all 5 of our club locations from the Carlson unit, Floating, Orton Keys, Black Hawk, as well as Stenstrom. So all 5 of these are centrally located throughout the city. Um, and we really pride ourselves on being able to create those partnerships with with a Harlem School District, as well as with Rockford School District as well, where where we're able to provide transportation from school directly to our units. So great partnership, and we're looking to increase the number of schools that support that transportation as well. Thank you for your time. Greatly appreciate the opportunity to speak a little bit more about what we're doing with the Boys and Girls Club of Rockford, and we look forward to continuously working with the Winnebago County Mental Health Board. Thanks.